Hello, urgent care crew. With the increasing populations we've been seeing, we need to talk about gender-related issues and how they pertain to health care.
Yay! Sometimes it's hard to know the difference between sex and gender.
The distinction between sex and gender differentiates a person's biological sex, the anatomy of an individual's reproductive system and secondary characteristics, from the person's gender, which can refer to either social roles based on the sex of the person or personal identification of one's own gender based on an internal awareness. The idea that there's a biological gender is an oxymoron. The biological aspects are not gender related, and the gender related aspects are not biological. In some circumstances, individuals assigned sex and gender do not align, and the person may be transgender. In other cases, an individual may have biological sex characteristics that complicate sex assignment, and the person may be intersex.
What are important biological and behavioral differences?
That's a good question. Male and female bodies have so many similarities that the practice of medicine until recently didn't make many accommodations for their uniqueness. While the reproductive organs obviously require separate specialties, researchers are discovering other ways that sex and gender affect health, disease, and medicine. A decade ago, a woman would walk into this urgent care and could expect medical care would be based upon research performed on men. We can now walk around and clearly see how women are different than men in the ways in which they have heart attacks, strokes, lung diseases, psychiatric disorders, autoimmune conditions, traumatic injuries, and responses to medications and treatments. Medicine today has an opportunity to embrace these differences to improve the emergency care of women. Some examples are: women are 2 times more likely to contract HIV than men. Women are more likely to attempt suicide, but men are more likely to be successful at it. Men are more likely to suffer a cardiac arrest outside the hospital than women. Women metabolize alcohol at a slower rate than men, leading to more cognitive impairment, motor vehicle accidents, and liver disease. These are just a few examples of things we might see come into urgent care, and we need to know this to treat them differently.
What are some negative gender-based impacts in healthcare?
That is a good question. There are some major healthcare disparities, health and healthcare disparities facing transgender people. Things like, we just don't know. Like 76% take hormones, whether monitored or not. We don't know what their change is or their desire to have any type of future surgery. A lot of things are just offensive to the transgenders. The things that people say, like he, she, or it, or are you a real woman or a real man? These are a hindrance to their health care. And we should actually be asking things like, when did you decide to be a man or a woman? Do you want the surgery? What is your real name? A lot of things that we need to keep in mind about transgender health is that the HIV, the mental health, the suicidal and non-suicidal self-harm, substance abuse and alcohol, tobacco use, violence and victimization, discrimination. A lot of times they delay seeking health care. They don't have health insurance coverage. And we're just not culturally adapted to treat them properly.
What are some new approaches to gender-based care?
There are a lot of different things that you have to take in mind. And that is, there's training, there's new approaches to gender-based care and between differences in men and women, and transgender that might, alter therapies and drug development, might benefit both sexes. Women should expect a vastly different medical landscape in the near future. There are now increasing recommendations that research be conducted to include the ability to determine if important differences exist between men and women, which we know they do. We need to move towards not only understanding differences in susceptibility of diseases for women and men, but also to tailor blood tests, imaging studies, and medical regimens based upon patient sex. There's things we can do at work for the transgender, the women and men, all of us. Be non-judgmental, open, professional. Provide client-centered care, not gender-centered care. Be an ally. Educate yourself so you're trans-friendly in your field of expertise. Working with colleagues. See something, say something. Think outside the box. Expand our understanding of gender.